Plan for the worst and work for the best. Yesterday I attended a COBRA meeting chaired by the Prime Minister in which we finalised our four-part action plan to contain, delay, research and mitigate the virus. This plan has been jointly agreed between the UK Government and the devolved administrations. Copies of the plan have been sent to members of both houses and made available in hard copy. The plan is driven by the science and guided by the expert recommendations of the 4 UK Chief Medical Officers and the Scientific Advisory Group for Emergencies. Our plan sets out what we know so far about the virus and the disease it causes, what long-term planning we've undertaken to prepare for a pandemic, what actions we've taken so far in response to the current coronavirus outbreak, and crucially, the role the public can play in supporting our response, both now and in the future. Mr. Speaker, the UK is well prepared for infectious disease outbreaks of this kind. The international data continue to indicate that for most people, this disease is mild and the vast majority recover in full. We've responded to a wide range of disease outbreaks in the recent past. The NHS has been preparing for a pandemic virus for over a decade. We have world-class expertise to make sense of the emerging data. We have a strong base on which to build. And while COVID-19 is a new virus, we've adapted our response to take account of that fact. Our plan sets out a phased response to the outbreak. Phase 1 is to contain. This is the phase that we're currently in. Mr. Speaker, contain is about detecting the early cases, following up with close contacts, preventing the disease from taking hold in this country for as long as reasonably possible. This approach also buys time for the NHS to ramp up its preparations. If the number of global cases continues to rise, especially in Europe, the scientific advice is that we may not be able to contain this virus indefinitely. At that point, we'll activate the delay phase of our plan. Delay is about slowing the spread, lowering the peak impact of the disease and pushing it away from the winter season. We are mindful of scientific advice that reacting too early or overreacting carries its own risks. So, subject to the primary goal of keeping people safe, we will seek to minimize social and economic disruption. Mr. Speaker, the third part of the plan is research. Research has been ongoing since we first identified COVID-19, and I pay tribute to the scientists at Public Health England who are among the first in the world to sequence its genome. Research is not just about developing a vaccine, which we're actively pursuing, but which will be many months away at the earliest. Research is also about understanding what actions will lessen the impact of a coronavirus, including what drugs and treatments, existing and new, will help those who are already sick. The fourth phase is mitigate. We'll move on to this phase if coronavirus becomes established in the UK population. At that point, it will be impossible to prevent widespread transmission, so the emphasis will be on caring for those who are most seriously ill and keeping essential services running at a time when large parts of the workforce may be off sick. Our plans include not just the most likely case, but the reasonable worst case. We will identify and support the most vulnerable. And if necessary, we will take some of the actions set out in today's plan to reduce the impact of absentees and to lessen the impact on our economy and supply chains. We prepare for the worst and work for the best. We commit to ensuring that the agencies responsible for tackling this outbreak are properly resourced, have the people, equipment and the medicine they need, and that any new laws they need are brought forward as and when required. This is a national effort. We need everyone to listen to and act on the official medical advice. We need employers to prioritise the welfare of their staff. And the single most important thing that everyone can do, and I make no apologies for repeating this, Mr. Speaker, is to use tissues when you cough or sneeze and wash your hands more often. It's in your interest, your family's interest, and in the national interest. We will get through this, Mr. Speaker, and everyone has a part to play. I commend this statement to the House.
Jonathan Ashworth.
I'm grateful, Mr. Speaker, and can I apologise to you and the House for being a few minutes late. I had a problem with my printer when I was printing off the Secretary of State's statement, but can I thank the Secretary of State for advance sight of the statement, and indeed advance sight of the action plan earlier this morning. And can I also put on thanks put on record my thanks for the briefing that the Leader of the Opposition and myself received yesterday from departmental officials, the Chief Medical Officer and the Chief Scientific Advisor as well. And I believe the Chief Medical Officer will be briefing parliamentarians yesterday, and I think that is a very welcome initiative. The government's strategy to contain, then delay, research and then mitigate has our endorsement, Mr. Speaker. But can I ask the Secretary of State for some specific clarifications? First, on containment and self-isolation. The Prime Minister said today, as indeed the Secretary of State has said before, workers who self-isolate are considered to be on sick leave. Can he confirm that those who do need to self-isolate will not therefore need to visit a GP to receive a sick note? Because of course the government's advice is not to present at a GP. He will also know that 2 million workers on low pay or insecure contracts in the gig economy don't even qualify for statutory sick pay. He will also know that those who are in receipt of benefits are often asked to physically attend appointments. So again, if they are asked to self-isolate, can he guarantee that no financial sanction will be imposed? But on the issue of sick pay, does he accept that people should not be forced to make a choice between their health and financial hardship? We're told he is considering emergency legislation. Will he bring forward legislation to remove these barriers to self-isolation so all workers can get the sick pay they deserve? This is in the interests of public health. If he brings forward that legislation, we will help him get it on the statute books quickly. He could do it this week, he could do it next week. We will support him. Let's give every worker the security that they deserve so that they do not have to put their health ahead of their financial interests or vice versa. Now, more broadly on the NHS and social care, and the response of the NHS and the support the NHS will be given through both the containment phase and the mitigation phase. We know that last week around 80% of critical care beds are occupied. We know that the NHS is short of 100,000 staff, and we also know that staff working in the NHS, particularly those on the front line such as GPs, need to be protected as well. Even if we take at face value the government's insistence that it has provided the NHS with the resources to deliver the commitments of the long-term plan, we obviously disagree, that's a debate for another time. But even if we take that at face value, we can surely all accept that COVID-19 is going to lead to increased demand on trusts and the wider NHS. Every trust that sends a sample for testing has to pay for it to be couriered. Trusts are likely to take on more agency staff. If retired staff are encouraged to return to practice, the wage bill will increase. And by the way, on retired staff, can he just reassure us that protections and oversight will be in place, particularly around those returning staff who, as we understand it, will not need to go through a revalidation process for their licence? And as we move into the mitigation phase, the government has recognised that, quote, non-urgent care may be delayed. I assume that means trusts will be looking at cancelling elective surgery, which will see waiting lists grow and again will impact on trust finances. Will the government provide an emergency funding increase for the NHS resource budget to support the NHS through this next challenging period? Directors of Public Health still don't know their public health allocations for the next financial year starting next month. It means that directors of public health could be cutting the nurse workloads they're responsible for commissioning at a time when those very nurses will be needed to deal with COVID-19 cases. Can he announce the public health allocations as a matter of urgency? Social care. We know that many who are at risk from this virus are the elderly and those with chronic conditions. Social care is responsible and has a duty of care to many of the people who are most vulnerable from this outbreak. What advice has he got for social care providers And will there be extra resources announced for social care services? On the emergency powers he has briefed, will he sit down with us and other opposition parties to discuss the content of that legislation? And finally, on the global efforts to contain the virus, disease knows no borders. We can't build a wall or an iron curtain around these islands. Why then is the government apparently walking away from the EU early warning and response system, which plays such a vital role in pandemic preparations? We're led to believe that Number 10 has overruled the Secretary of State. And secondly, to contain the virus internationally, those countries with weaker health systems need to be supported as well, otherwise we will not contain the virus. Can he update us on what help he is offering the World Health Organization on that front? Mr. Speaker, this is a serious time. Our constituents will be concerned, many will be frightened. We will raise our concerns responsibly, but we offer to work constructively with the government because, Mr. Speaker, the public health interest and safety of our constituents must always come first.
Thank you very much, Mr. Speaker, and I'm grateful to the constructive approach set out by the Honourable Gentleman opposite, which he's taken from the start, and I'll seek to address all of the questions that he raises. The first point he raised is about statutory sick pay. Those who do need to self-isolate for medical reasons to protect others, that counts as being off sick. They do not need to go to a GP because there is a 7-day allowance for self-declaration. So I hope that addresses that point directly. And we keep all matters on this under review because broadly I agree with him on the principle that he set out. On the NHS, he asked about resources. We have already increased resources to the NHS, and we stand ready to do so if that is necessary. He asked about doctors and revalidation. In legislation, we are proposing to make revalidation simpler, and we'll bring forward those measures and indeed, of course, engage with the opposition on the potential measures as and when that is necessary. On public health allocations, we've already been clear that the public health grant in aggregate is going up, and as my right honourable friend, the Community Secretary, set out last week, we've seen a 4.4% real terms increase in local authority budgets this year, and of course the social care budget is going up by £1 billion. So I think that takes into account the issues that he raised. He also raised the engagement with the World Health Organization, and we have supported the World Health Organization with extra funding. And in terms of engagement with the EU, I have regular engagement with colleagues from across Europe, and some of the reports that I've seen in the newspaper are not accurate because the questions of engagement with the EU on matters of health security are a matter for the negotiations as set out on Thursday in the negotiations document.
Thank you, Mr. Speaker, and I'd like to commend the Health Secretary for the calm way that he's been dealing with this crisis and the very clear public messaging. He called me last Friday to tell me that there had been a coronavirus outbreak in my constituency, and I would like to thank the staff at the Hazelmere Health Centre for their extraordinary commitment in working over the weekend so that the health centre could be open again on Monday morning. But this does show that some of the people at greatest risk are frontline health workers. One study in China showed that 7% of the people who got the virus in Wuhan were health workers. So will the Health Secretary confirm whether hospitals, GP surgeries, care homes, nursing homes have enough face masks, gloves, hand gel, and any other measures he's taking to make sure that NHS staff are kept safe?
My right honourable friend raises an incredibly important point, and the answer to the question is yes. We're putting out further advice and guidance to the health system, to the NHS, to GPs and to hospitals today that will go out from Keith Willett in the NHS. And on the point about the kit needed to keep health workers safe, yes, we're putting in place the actions to ensure that that is available at the right moment when it is needed. So there are some GP surgeries, for instance, that do not have that equipment yet, but we're putting in place the actions needed to ensure that they have it as and when it is needed. As he knows, the number of cases right now is relatively small. It is 51 as of 9 o'clock this morning. The protective equipment is there so that for each of these cases we can get right onto them. But if it becomes more widespread, of course, more and more NHS settings right across the country are going to need that sort of equipment.
Philippa Wood. Thank you very much, Mr. Speaker. I welcome the plan. I have to say I would have welcomed receiving the briefing that the Shadow Secretary of State mentioned yesterday, which I did not receive. This does lay out a reasonable worst-case scenario and is very clear about the 3 timed phases because, of course, research is ongoing, and I think it helps prepare the public for decisions that may have to be made down the line. At the moment in containment, it is based on self-isolation of cases, contacts and those who have travelled to risk areas. But with the spread elsewhere in the world, it's becoming harder to define risk areas. With regards to North Italy, this Chief Medical Officer talked about those with underlying conditions, perhaps interpreting advice more stringently and not travelling. So will the government either discuss with insurance companies or even consider litigation so that having underlying conditions would be an acceptable reason to cancel a holiday and actually get the money back rather than people putting themselves at risk? I would agree with regards asymptomatic workers and sick pay, but there are staff who have no sick pay in their contract. So there has to be some protection given to them. And while the Secretary of State referred to the 7 days self-certification, isolation is for 14 days. And we do not want people turning up at a GP surgery halfway through that period. So can that be looked at? One of the issues that I've come across is where an employer has told a member of staff that when they return from holiday in Tenerife, they should not come to work for 2 weeks, but the employer does not wish to pay them. So we need to look at that, even if it's not health advice, but an employer stipulation, but expecting people to have no income. Obviously, as we move into delay, we see that children are not particularly catching this, but as with other coronaviruses, they may well spread it. I wonder if we have evidence for how much they contribute to transmission, as that will affect decisions around school closures. And what preparations are being made for the long haul. If we look at previous corona outbreaks, they have not just been over a few months, they have often been over a year or so, and we could be dealing with this in next winter. If we move into mitigation, it reverses, and it's about protecting the vulnerable and early discharge to home care. This may require the changing of staff from hospitals and care homes to actually work in the community. So is the government in negotiations about things like legal responsibility and liability? And of course, the Secretary of State quite rightly talks about what the public should be doing. But should we be already thinking about stopping shaking hands? Should we already be thinking about working from home if we can without an economic impact? This would help the climate emergency as well as this. But containment moves into delay without a border, so should we be thinking about trying to get ahead of the curve?
Hear, hear.
Thank you very much indeed. Mr. Speaker, we have been briefing colleagues as much as possible. Clearly the CMO's time is incredibly valuable at the moment, and we did sign off this plan and work with the Scottish Government with this plan, and this plan was signed off by both the First Minister for Scotland and the CMO for Scotland. So we've been, in fact, it is a plan that has been developed with the Scottish Government and with the Welsh Government and the Government of Northern Ireland. So it is ultimately a multi-party plan. She makes the point about 7-day certification. That is indeed the sort of reason that we're holding this area under review, and there's work ongoing, including on the points that she raises. She also raised the point about shaking hands. The medical advice on shaking hands is that the impact of shaking hands is negligible. What really matters is washing our hands. And so our public health advice will remain clear and based on that science, which is that what matters more than anything else is that people wash their hands for 20 seconds or more using soap and preferably hot water. That is the core of the public health advice. She also mentioned working from home. And there's an incredibly important point that is written into the plan, which is about timing. There are actions that we may need to take in the future that it is not appropriate to take now. So we are not advising people that they need to work from home now, but we don't rule out doing so in the future when that might be more effective clinically, given the disruption that it could cause.
I'm expecting to run this for around an hour, so let's help each other. Dr. Luke Evans.
Thank you, Mr. Speaker. In regards to the coronavirus and the impact it can have, he's quite right to balance the difference of health and the economy, and I welcome his caution with regards to this. One thing that I would like to raise is the point about small businesses. If this does become a bigger, more significant problem, does he foresee a point where, for good businesses, they may need an emergency loan, and is that something the government would be considering? And if not, would he ask the other department to see if that would be something they would consider?
Of course, we are considering that. It's being led by the Business Department in conjunction with the Treasury, and the Chancellor is making a statement today ahead of his budget on the 11th.
Thank you, Mr. Speaker. The Secretary of State will know that there's a system where those who are immunosuppressed are not required to sit in a crowded waiting room if they have to be in hospital or at A&E. And that's in normal conditions, never mind these COVID-19 conditions. Last evening I attended Aintree Hospital with a patient who had just finished the first round of chemo, and we have the chemo aware system, and she was told by the receptionist to sit in a very, very crowded waiting room where there was a 5-hour wait, and she was told that that's where she would have to be because there was nowhere else for her to go. I stood in a corridor between the front door and some sliding doors to ensure that she didn't have to be subject to that. So my question to the Secretary of State is how he's going to ensure that those frontline staff, not necessarily clinicians, those frontline staff actually understand the difficulty and the increased danger, but also does each A&E, does each hospital have a place where those people can wait safely? This is not good enough.
The answer is yes. That each A&E has a pod now in front of it, which we've funded since the outbreak of this virus, so that people who are suspected cases can go into that pod, not into the main A&E, to try to address exactly the sorts of problems that she addresses.
Sir Graham Brady.
Does contingency planning include steps to secure additional capacity in private hospitals, which often would lend themselves better to isolation of infectious patients?
Well, of course, the question of how we deliver and who delivers NHS services is a matter for the NHS, and making sure that we use all of the health facilities available is something that, of course, the NHS is considering.
Thank you, Mr. Speaker. Does the Secretary of State agree with me that for self-isolation to work, whatever an individual's circumstances, they have to be not out of pocket for doing the right thing, and that there are currently, as my right honourable friend said, millions of people, not only in the gig economy, but who don't qualify for sick pay, who would be out of pocket for doing the right thing. And does he therefore agree that solving this problem and giving people the confidence that they have to do the right thing and self-isolate is one of the most important things he can do in the next few days to ensure that we can continue with containment?
Well, there's a huge amount of things that we need to do in the next few days, and as I said, this area is under review.
Noakes.
Thank you, Mr. Speaker. Across government, in different departments, there are many people with healthcare experience and professionalism. I use as an example the DWP, where we know there are 3,000 trained professionals working on assessments. What conversations is my right honourable friend having with other Secretaries of State to understand whether there could be access to those individuals so that they too can be on the front line?
Well, that is absolutely something that we're willing to look at.
In his answer to my question last week, I asked the Secretary of State about the preparedness of NHS 111. In a written question to the department, they say they don't have the numbers for current staff, and I understand that Dudley call centre alone is asking to recruit 150 new call handlers. Could he say what is the number of call handlers we are looking for in addition to the current staffing levels for NHS 111, and when would he expect that they are fully trained and online?
We have increased the number by 500 already, with plans for more to come as and when that's necessary.
Dr. Caroline Johnson.
Speaker, increasing numbers of people are self-isolating, but they still require routine care. Are GPs providing this routine care? And could the Secretary of State tell the House what provision is made and what advice is being given to GPs, whether they should wear masks, whether they should visit the person at home or get them to come for surgery and such things? Thank you.
The answer to the question is that we don't want people who suspect they may have coronavirus to go to their GP. We want them to do this by 111, and they can, in addition to my answer previously on the point about being able to self-validate in terms of for sick pay for 7 days, you can of course then do that by phone and get an email confirmation should you need to extend that for the full 14 days. We of course, as well as tackling coronavirus, the NHS must do business as usual. Now we are rolling out an increase in the amount that you can do over the phone and over Skype and other ways of looking at telemedicine. They can be increasingly important when there is a widespread concern around communicable diseases.
Judith Cummins.
Thank you, Mr. Speaker. Can the Secretary of State tell us what steps he's taking to ensure continuity of social care in both care homes and caregiving at home, given the workforce problems and implications arising from this?
Yes, we have a huge amount of work underway, and including looking at what we can do to make sure that people can get support in care homes, and also, of course, those in. It's not just about the staff, of course. Some of them, those who are, according to the data, most vulnerable to this disease are the elderly in care homes. So making sure that the care home element of our plan is incredibly important, and we'll be coming out with more details in the coming days.
Thank you, Mr. Speaker. It is very important that both the resolution and the management of this crisis is based on the best possible science. And I join the Secretary of State's tribute to the UK scientists who are amongst the most experienced and best qualified in the world. So can I ask him, have UK scientists been part of the WHO teams that have been deployed to Iran and China? Can he tell me whether the government chief scientist is a member of the COBRA meetings? And can he update me on the question that I wrote to him on Thursday about as to when we can expect a bedside test to be deployed in this country and made available around the world?
Yes, of course we're involved in the World Health Organization missions and in some direct bilateral missions. I've repeatedly signed off support for more UK experts to go out around the world. The Chief Scientific Advisor is, of course, at all of the COBRAs on this, whether they're chaired by me or by the Prime Minister. And his point on the bedside test is incredibly important. We're currently engaged with just over a dozen companies to try to come up with a bedside test, so that instead of taking a swab from the back of your throat, Mr. Speaker, should you have the misfortune to fall ill, and that then have to be sent away and then brought back. Looking for and working with UK companies to get a bedside test where it can be done on the premises is an incredibly important part of the diagnostic mission surrounding this disease.
Thank you, Mr. Speaker. Will staff in community settings be issued with protective hazmat suits and masks?
We have extensive stockpiles of personal protection equipment. We are not distributing that at this moment because we've got to distribute it at the right time, and at the moment each individual case can be dealt with because they are relatively few by those who are experts in use of that kit. But of course, the community staff, as well as primary care staff and hospital staff, will be involved in the distribution of that equipment as and when that's appropriate.
Robert Largan.
Thank you, Mr. Speaker. Last week there was a confirmed coronavirus case in Buxton, which led to the temporary closure of a medical centre and a school. Unfortunately, several national newspapers inaccurately reported that Buxton was a town on lockdown. Several local hotels have now reported booking cancellations as a result. Does the Secretary of State agree with me that the situation calls for responsible journalism with calm reporting of the facts? And will he join me in encouraging people to visit Buxton, Britain's best spa town?
Yes, I don't think I have to check with the Chief Medical Officer before telling you, Mr. Speaker, that I love going to Buxton and it is a great place to visit. But the point that my honourable friend makes is a very serious one. As I said in the statement, the scientific advice on moving too soon or on overreaction is there in the same way that moving too slowly or not reacting strongly enough is there. We need to absolutely take the measures that are necessary to protect the public, but taking measures that don't protect the public, and in particular communicating about this for all those of us with a position of responsibility whose communications are heard in a widespread way, where the members of this House or the media have a duty of responsibility, because the way that this is communicated will have a direct impact on how well we as a country cope with this outbreak.
Hospital cleaners and porters keep us safe. So will the government increase SSP to full pay for all staff forced to self-isolate? Low-paid workers in our NHS shouldn't be financially penalised for doing the right thing.
Well, as I say, in terms of the rules around SSP, we keep them under review. But within the NHS, where we directly employ people, that is something that I'm having a conversation with the Chief Executive of the NHS about.
Mark Harper.
Thank you very much, Mr. Speaker. The Secretary of State will know there are 2 confirmed cases in Gloucestershire, and I want to put on my record my thanks to the public health professionals who've dealt with those cases in a very professional, calm and considered manner. My specific question is about action that the Department for Work and Pensions will be taking for those members of the public who, whether they're because of business downturn or because of self-isolation, have to access the benefit system, and whether frontline DWP staff and systems will accommodate the fact that self-isolation, as the Secretary of State says, should be treated as an illness and no inappropriate sanctions are applied.
Well, we are absolutely clear that that is the rule, and I'm talking to the Secretary of State for DWP frequently on this matter.
Thank you, Mr. Speaker. Following the outbreak at Willowbank Infant School, will the Secretary of State update the House on the work which he's undertaking with the Department for Education, local authorities and schools to help contain the outbreak?
Secretary of State.
Yes, absolutely. The broader point on schools is that it's very important that schools don't close if they're not advised to close. And again, it's about following the medical advice. If there's no epidemiological reason to close the school, then the school shouldn't be closing. Currently, as of 11 a.m. today, I understand 10 schools are closed. And the 7 of the 14 schools that were reported yesterday as closed are now open. So this is a dynamic situation. The DFE have been doing an absolutely fantastic job, and I pay tribute to my right honourable friend, the Schools Minister, who has been working night and day to make sure that where children can be at school, they are at school.
Alex Shelbrooke.
Speaker, my right honourable friend will recall a couple of weeks ago that I raised the issue of motorway service stations. Coming down this week, I still did not see any signage up about the health precautions could be taken. Could I urge my right honourable friend to investigate whether he could actually buy up the advertising space in the actual lavatory areas to make sure that message is clear, and people understand the hygiene activities they have to take.
This is an important point, and we are tomorrow launching an enhanced communications programme, and I will check in with my team as to whether that includes adverts in motorway service stations.
Liz Saville-Roberts.
Rural Wales has a high percentage of self-employed people. ONS data suggests that Gwynedd has 23% of households self-employed compared to a Welsh average of 16%. What provisions have the four governments made to assure self-employed people that they will be compensated for lost income arising from the COVID-19 outbreak?
Well, I'm working both with the Welfare Secretary and also with the Welsh Government, who themselves have done have played their part with great care and responsibility in rising to this challenge.
Stephen Hammond.
Thank you, Madam Deputy Speaker. Can I thank my right honourable friend for his statement and commend him for the way he's handling this outbreak. The public health advice has been absolutely clear during the contain phase. As we move into the delay and mitigate phase, particularly for vulnerable groups with regard to social distancing or longer isolation periods, could he be clear that he will make sure the advice is as fast and have the same clarity?
Yes, tomorrow we are upgrading the communications activities, but should we move into the mitigate phase, then clearly the communications will need to be different and upgraded yet again.
Meg Hillian.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, we've known for years that people on outsourced contracts haven't got access to sick pay, and coronavirus is now throwing up that problem for the wider community. Yet we heard the Secretary of State for Business talk about people going onto universal credit. I don't think the Minister lives in the real world if he thinks that's possible in 3 days. We've heard the Secretary of State today to talk about 7 days isolation, then when pressed to talk about ringing the GP. Can the Secretary of State give very clear advice to those people who have to choose between work and eating in order to make sure that they don't go to work when they're ill?
I've been absolutely clear about the legal position around this, and I've also said that we're keeping the area under review.
Craig McKinley.
As cases escalate, we have to assume that they probably will. Even a very well-prepared NHS will become stretched, with health professionals likely to be affected. Self-help will become important. We're already seeing a national shortage of hand sanitising gel. Could my right honourable friend work with the manufacturers to ensure that those basic products like paracetamol, ibuprofen, cough medicines will maintain their availability widely on the high street?
Absolutely, my own friend is completely right about this, and in fact our no-deal planning and our no-deal stockpiles are playing an important part in making sure we're fully prepared and ready.
Hilary Benn.
Thank you very much indeed, Madam Deputy Speaker. On when to move to the delay phase, the Secretary of State said that he was mindful of the scientific advice that reacting too early carries its own risks. Could he set out for the House what those risks are?
I'd highlight two. The first is that there is an economic and social impact of disruption. If an action has no medical benefit, then there's no need for that disruption. But the second is a medical risk, which is that behavioural science and experience from previous similar such outbreaks shows that if you ask people too early to do things that are disruptive to their normal life, then they may try to return to normal earlier than they otherwise would. And at the moment, the number of cases is relatively small. If we go into the reasonable worst case scenario, then it will rise sharply and be high for a number of weeks. And we then need to keep people doing the right responsible thing over a period of weeks. And if you ask them to move too soon, then they may question whether that advice was the right advice.
Steve Bryan.
Experience here suggests that these outbreaks are about cool heads and timing, and I would suggest that the Minister and his Chief Medical Officer and his Public Health Minister have been exemplary in both of those things. Would he agree that the media have a responsibility here in presenting... You don't release everything in the locker at once, and that's not about the government being slow to this, that is about the government having a plan, and what the government have set out today is a very clear, a very strategic and a very staged plan to do what's needed when it's needed in the national interest.
Well, I'm grateful to my honourable friend for what he says, and we are trying to take exactly the approach that he sets out, and it builds on my answer to the right honourable gentleman opposite, which is that getting the timing right, as well as the decisions over the correct actions to take, both of these things you've got to get right, and we'll be guided by the science in supporting the public through what will be a difficult time.
Yvette Cooper.
The Health Secretary will know that many people are caring for elderly relatives, sometimes just popping in every day to make sure they're fed or to get them up in the morning. If those people end up having to self-isolate or getting ill, what support will there be both for them, where they may not be getting any sick pay, but also for the elderly relatives who depend on some urgent support and may not have any other relatives nearby to provide that?
We are very concerned about this issue, and in the communication I indicated earlier that we'll publish soon to social care providers, we will address precisely the issue that she raises. It is a very important and difficult consideration for what you do in a reasonable worst case scenario. Of course, all the time we're working to avoid the reasonable worst case scenario as well. One of the areas that's been highlighted in public is, for instance, making it much easier to onboard volunteers, but volunteers are not the only part of the answer to this problem.
Craig Whittaker.
Deputy Speaker, Gamma Healthcare from the Calder Valley are playing a vital role in China as part of the bundled approach with infection control with COVID-19. Adrian Fellows, who's a scientist from Gamma, says washing hands is vital. However, his concern is that every hand wash is being promoted as an effective intervention, even those that are cosmetic-based. Similarly, supermarket sanitisers without a log4 reduction are all running the risk of giving a false sense of security. Will my right honourable friend ensure that government advice on hand washing is thorough so that people don't run that risk of a false sense of security?
I'll look into our guidance precisely on the nature of hand sanitisers and make sure that it takes into account the very best scientific advice. But there's a broader point, which is that whilst sanitising your hands with hand sanitizer is good, it is not nearly as good as washing your hands for 20 seconds with soap and preferably in hot water. That is the best thing to deal with the virus.
Lloyd Russell Moyle.
I want to say thank you to the Chief Medical Officer for ringing me when we had cases earlier on in the month in the city, and it was very helpful advice. The advice that he's just given is that we need to wash our hands. So will the government make moves to ensure when you enter every single building in this country, there is a place to wash your hands? And I don't just mean in advice, I mean, can we introduce guidelines, health and safety guidelines, to require every single employer, every single restaurant, if we're going to take this seriously, we need to up our game. Will the government commit to that now?
I'll look into whether that, the extent to which that can be done. I mean, many public buildings do have sinks available, and really, you know, at the core of our response to the problem, which the honourable gentleman reasonably raises, is getting the communications right so that people can use existing sinks and soap that's there in order to be able to do what I know he wishes.
Anthony Mangill.
Can I thank the Secretary of State and his team for yesterday keeping me informed of the 2 confirmed cases of COVID-19. But there were also a number of schools that decided to close their doors as a precaution. What message does the Secretary of State have to those schools and other schools across the community as to how to deal with this issue?
I commend the honourable gentleman for the responsible and calm way in which he's responded to the news in his own constituency. The message to schools is very clear, which is that if you do not have both a positive case and the advice from Public Health England to close, you should not close. It's a message that the schools minister sitting next to me reiterates. We have a hotline that schools can call to get that advice from Public Health England, and those schools that close without the advice from Public Health England are contacted by the Regional Schools Commissioner to explain to them the position.
Daisy Cooper.
Deputy Speaker, There are now 4 confirmed cases of COVID-19 in Hertfordshire, and yet Hertfordshire has an unfunded burden in next year's financial budget of £2.8 million from the cost of the pay uplift for nurses and health visitors under the Agenda for Change programme. Now, I am told that there is potentially up to 30 directors of public health across this country who are poised to have to cancel contracts and make school nurses and health visitors redundant up and down the country if this money is not confirmed. So with less than a month to go until the next financial year, can the government confirm today or within the next 24 hours that the money for the Agenda for Change pay uplifts will be made available?
Well, we've increased the public health grant, and we've increased local authority spending power by 4.4% in real terms next year, which of course comes in at the start of April.
Alan Mack.
My constituency includes a number of semi-rural, coastal and isolated communities where information on as local a basis as possible will be needed, not just the national picture. Can my right honourable friend provide me with the relevant departmental and public health England contacts so I can obtain this information in real time?
Yes, I'd be very happy to do that.
Thank you, Madam Deputy Speaker. Can the Secretary of State confirm that claimants will not face benefit sanctions if they miss appointments because they're choosing to self-isolate?
Absolutely our intention, yes.
Robert Halford.
Thank you, Mr. Speaker. Will my right honourable friend thank the Prince Alexandra Hospital in Harlow for dealing with a case and all the work that they do, but could I just bring him back to the question of workers? In Harlow, there are at least 8,000 people working in retail, food, customer service, front of house, leisure, transport and accommodation services, and these people, often on lower pay, could potentially lose their wages, especially if restaurants cut down the number of staff for one reason or another if there is a serious outbreak. Would the government consider setting up an insurance scheme if things get much worse to ensure that individuals like the ones I've mentioned, workers, don't lose out on their incomes?
We are, as I've said several times, we are keeping this area under review, and we're also looking into what we can do to support successful businesses who might have short-term negative impact from some of the disruptions that have come with and could come further with coronavirus.
Alex Norris.
Thank you, Madam Deputy Speaker. Sick pay and statutory sick pay can be complex, but there's one simple truth within that system, which is the poorer you are, the poorer your protections are. Now, those very worst off at work are looking at us and wanting clarity that doing the right thing and following the Secretary of State's guidance will not put them at a detriment. Nothing in the public conversation, and frankly nothing we've heard today, gives me confidence to say that to people in my community. So will the Secretary of State take this opportunity from the dispatch box to say not one single person in this country following his advice will suffer a detriment to their terms and conditions?
I've already made clear that we have a robust statutory sick pay system in this country, and that self-isolation counts for illness within that system, and that we're keeping the system under review. So people can have confidence that if they are asked to self-isolate, that is exactly what they should do.
Thank you, Madam Deputy Speaker. Sadly, it is healthcare professionals who are likely to be most exposed to this virus. What steps is the Secretary of State taking to make sure we have sufficient numbers of healthcare professionals at work to deal with this crisis?
Well, this is an incredibly important issue, not least because of the impact of the virus directly on healthcare workers in other jurisdictions, and we've seen that here too. And so we have a broad programme led by the NHS to make sure that we both protect our healthcare workers, both the clinicians and the non-clinicians, as the honourable member opposite mentioned, and to ensure that we have as much support in the NHS as possible, including from recently retired people, for instance, and again from volunteers, as was discussed earlier. If this virus becomes widespread, then it will be all hands to the pump in the NHS, as with social care, and we've got extensive planning underway to make sure that the NHS can respond.
Chris Matheson.
Thank you, Madam Deputy Speaker. I've been contacted by a constituent who is a consultant in emergency medicine at the Countess of Chester Hospital, which the Secretary of State knows very well. He has expressed concern about the use of nebulisers for for the delivery of medicines for respiratory illnesses on the basis that there is evidence that these might enhance the spread within the confined space of airborne viruses. I have been in touch with the Public Health England about this. There's some debate as to whether that they agree with my constituent or not, but he's provided evidence from the 2003 SARS outbreak that demonstrates that these fears may be upheld. It's a technical point, but can I ask the Secretary of State to look into it and get his officials to check it out?
Yes, of course. I wouldn't dare to pronounce on the science and the medicine behind that, but what I can do is ensure that the experts, including the Deputy Chief Medical Officer, who is an expert in these things and is in the box, will be able to respond.
Stephen Crabb.
I really commend the Health Secretary on the very constructive way that he's worked with the other health ministers in the devolved administrations to get this plan ready for today. But could I remind him of the importance of continuing this approach as the situation unfolds in the days and the weeks ahead to ensure that there's a genuine, joined-up UK-wide strategy to combat coronavirus?
Yes, I would say that this is devolved government and UK government working well together, and the best example of this is the 4 CMOs. Each devolved nation, as my right honourable friend well knows from his time as Secretary of State, each devolved nation has its own CMO, and the forum of the 4 of them provides an extremely useful both place to debate and then to agree, so that we can have a UK-wide answer, even though some of the areas, like the delivery of the NHS, are devolved.
Caroline Lucas.
In times of crisis, fear can foster discrimination. There's serious concern about reports of racism being linked to the coronavirus outbreak, with people being singled out and abused simply because of East Asian appearance and some children being bullied. Does the Health Secretary agree that inaccurate terms like the Wuhan coronavirus should be avoided, because that sadly reinforces racist views? Will he take steps to ensure that government communications always use medically accurate terms? And will he ensure that the Cabinet acts to ensure that everything possible is done to stop the denigration and blaming of people in relation to this outbreak?
Yes, I agree with all of those.
Andrew Bowie.
Can I thank my right honourable friend for his statement, and following on from my right honourable friend's question about working with the devolved administrations, can my right honourable friend confirm that where the delivery is devolved, that this is a whole UK plan, and so there is no confusion in any of the devolved areas of this United Kingdom, that this is a UK-wide plan, and that the information being published today is applicable and the same to every part of the United Kingdom?
Well, that's right, and in fact the document is badged with the badges of the 4 nations. There are elements of it, of course, that are technically different in terms of delivery, but they're set out in the plan. And Madam Deputy Speaker, if I may, the Deputy Chief Medical Officer has already got me a note to answer the previous question, which is that the expert committee NERVTAG has looked at the issue of nebulisers and do not consider this an infection-prone procedure.
Chris Bryan.
Something has changed overnight. The 111 service is not available in the majority of Wales, and most people in Wales will be far better advised to ring 0845 4647, the NHS Wales direct telephone number. But my bigger anxiety is that so far the Minister has still not been able, despite all the good things he's done, he's not been able to answer this central question of people on 0 hours contracts. That is a large number of my constituents who would want to do the right thing, but from what he's said so far, will be financially out of pocket because there is no means of recompensing them. We surely must put this right, because otherwise we have a massive hole in the plan.
As I've said many times, we have a robust SSP system, and we hold it under review. On the point about 111, we've actually changed the system, so if you do dial 111 from Wales, it automatically redirects you to the NHS direct number in Wales.
Richard Graham.
I welcome the Health Secretary's clarification that schools should not close unless they absolutely have to, not least because if parents are going to be there looking after their children, there may be less nurses and doctors who can get to hospitals. My right honourable friend knows that the average age of volunteers at hospitals, including my fellow workers at the Gloucestershire Royal Hospital, is of an age where they could be at risk to this virus, and they're often the receptionists. So can he consider the NHS giving guidance to hospitals on whether having them as the front line for people who still come to hospitals thinking that's the best thing to do to be checked?
Well, in the first instance, the best thing to do if you think you have coronavirus is not to go to a hospital or GP surgery, but to ring 111 wherever you are in the UK. The other point that he makes, he's quite right.
Alison Toulis.
Madam Deputy Speaker, I'm strongly in favour of getting the habitually clarity to wash their hands, so I'm glad that he is reinforcing that message. But could I ask very specifically around the advice to DWP decision makers? Can I ask what advice specifically has been circulated within the DWP, and could all elected members get a copy of that just in case any of our constituents find that that advice is not being followed through?
I'll take that issue up with the DWP Secretary of State.
Thank you, Madam Deputy Speaker. I thank the Secretary of State for his statement, and I'm sure he'll agree with me that as the virus possibly spreads, members of the public will be worried about what they should and shouldn't be doing. So can the Secretary of State confirm how he will specifically communicate with members of the public to prevent panic, particularly if there is an event where we have to restrict public meetings and the use of public transport?
Well, it's a very good question and very important to get right. One of the reasons that we've set out this plan today, including with measures that we hope not to take, we may not take, but we are prepared to take if they are necessary, is so that should these measures be taken, it won't be a surprise to people. It's clearly part of a plan. Because I do understand, of course I do, that people are worried about this. And I also understand that some of the things that we're proposing and some of the things other countries are doing are not the sort of things that a government in a free country does normally. That's why we've taken this approach. It's quite unusual in government to set out a plan of things you might do. Normally in government you set out what you are going to do, and the reason we've done it is precisely in response to the concern that my Honourable Jen very wisely raises, which is that we want to do everything we can to reassure people whilst not overly reassuring and instead being totally transparent about our frank assessment based on the science of the situation that the country's in and what we can best do to get ourselves best through this and fight this disease.
Dame Diana Johnson.
Thank you, Madam Deputy Speaker. For those trusts that host regional infectious diseases units, can the Secretary of State say what additional emergency money is going into them now, and whether there are plans to extend those units to increase bed capacity?
We do have plans to be able to ramp up the bed capacity that can be used to deal with coronavirus patients. And as I said earlier, we have already extended funding to trusts and are willing to consider that more if that's necessary.
James Wilde.
Thank you, Madam Deputy Speaker. People are understandably concerned, and I've been contacted by some of my constituents about potential treatments that are appearing on the internet, including vitamin therapy. Can my right honourable friend send a clear message from this chamber that it's the NHS and the government that will provide the authoritative advice on medical treatments? And will he work with social media companies to remove any misleading content?
Yes, this is a very important point, that fake news in response to a virus like this can be dangerous and damaging to health, and it should be taken down. I'm working with the social media companies. I spoke to the main social media companies yesterday. The biggest social media companies are playing a very responsible role. If you search on Google, then the top 2 sites that come up for coronavirus are World Health Organization, the NHS is 3rd, and they are promoting good, high-quality, medically informed advice, and the other social media platforms, the major ones that we're working with, are also taking this very seriously.
Greg Davis.
Madam Deputy Speaker, would the Secretary of State agree that the key drivers of aggregate transmission are firstly the level of movement and secondly the level of assembly? And therefore would he take this opportunity to advise in particular elderly people who are more at risk that they would be well advised to restrict their movements, maybe go to the shops once a week instead of twice, maybe working when they can in a sustainable way from home rather than in work, and whether he'd also agree that people should avoid, if at all possible, big assemblies of people where transmission is higher. Otherwise, we'll end up having to enforce roadblocks and confinement, etc., much more quickly than otherwise.
No, Madam Deputy Speaker. We will be advised by the science, and this point that has been raised many times is really important in terms of timing, because there are both downsides in terms of the disruption and downsides, medical downsides, in terms of controlling the spread of this virus if things are done too soon. And so I think I'm very happy to arrange a briefing for the Honourable Gentleman. A briefing is available with the Chief Medical Officer at 4:15 today for anybody who wants a private briefing, any member, and I'm very happy to take him through some of that science.
Speaker, I thank the Minister for his diligence. Some 11.8 million people, elderly people, 18% of the population, some 4 million diabetics, 6% of the population. I declare an interest as one of those. Those who had the flu jab to protect from flu may feel that they are okay. Will the Minister give guidance for this section of people, those with chronic diseases and the elderly who have had the flu jab?
Yes, we're paying particular attention to vulnerable people, the elderly, those with other conditions, health conditions that may make them either more susceptible or more at risk should they get this virus, and there'll be additional advice in due course, guided by the science, as all should be in this in tackling this disease.
Vicky Foxcroft.
Thank you, Madam Deputy Speaker. The Secretary of State's been asked about this several times, and I'm slightly worried that he just doesn't get it. Some working people don't get sick pay. What we really need to know is, what are his plans for those people?
As I've said, I've answered this question a number of times, including that we're keeping this under review, and that that the sick pay system is robust, and I look forward to answering more questions the same. But I can't give a different answer to the one that I've given to the same question when it's been repeatedly asked.
Point of order. Point of order, Chris Browd.
Just further to what we've been talking about, wouldn't it be a good idea if the parliamentary estate were providing leadership to the country on this issue? We actually have lots of toilets in this building that don't work properly, where there's no soap, where it's difficult to wash your hands properly. Wouldn't it be a good idea if we led by example, and every single public, because we have thousands of members of the public who come here in here every week, people from all over the world, tourists who want to see this place. Could you use your good offices not to wander around all the toilets yourself personally, Madam Deputy Speaker, but nonetheless just to make sure that the staff understand that this is a very serious, important issue that we need to get right?
Well, I thank the Honourable Gentleman for that point of order. Silver Command meetings are held every day to discuss the situation in Parliament. The House of Commons Commission will be discussing this at their next meeting, and Mr. Speaker has held meetings with the Chief Medical Officer, so I can assure the Honourable Gentleman that the House authorities take this very seriously, and that the Speaker and the Commission take this issue very seriously, and any further information will be passed on as soon as it is forthcoming. Great Davis.
Would the Deputy Speaker like to extend that conversation to have hand sanitisers in various places across the estate, as well as cleaning the toilets, as has been said, so that people are in a position to cleanse their hands wherever they are at any point in the estate?
Well, I thank the Honourable Gentleman for that point of order. There are hand sanitisers in various places around the estate, but again, that is something which is kept under review on a daily basis. Thank you. Presentation of Bill, Secretary Priti Patel.
Domestic abuse.
Second reading what day?
Tomorrow.
Tomorrow. Presentation of Bill, Daisy Cooper.
Sentencing women.
Second reading what day?
10th of July, Madam Deputy Speaker.
10th of July. Thank you. Presentation of Bill, Layla Moran.
School toilets, access during lessons.
Second reading what day?
Friday the 13th of March.
Friday the 13th of March. Thank you. Presentation of Bill Andrew Stevenson.